Hi, my name is Trin. I'm a Barry University nursing student, and today I'm going to show you how I do priming of an IV bag and adding a secondary line to it. So first, I'm gonna do hand hygiene. You gotta do hand hygiene just so that I don't contaminate the bag or any of the IV lines. Put my gloves on. And then I'm going to the system to confirm that I have the right solution that the doctor ordered by looking into the computer, and then when I go into the patient's room, I'm gonna scan the patient. ID man asking for like a 2 identifier and looking into the system, knowing that it's the right patient, and double check that I have the right solution as well. So the doctor ordered 500 milliliter sodium chloride, which is what I got, and then I have to inspect the solution bag, see if anything is floating in the solution, if there's any color changes that indicate that it's probably not good anymore and you need to get a different bag, and then check the expiration date. And then you would open a primary line here and try your best not to contaminate the line. This one's going to be striking into the bag, and this one is going to go into the patient, and then I have to clamp the line because I don't want the water to flow everywhere when I am unclamping it. So I got it clamped. Okay, and then usually there's like a sticker that will go that's from the bag that can go right here, indicating when you change the bag or when you change the line, what time it is, what day it is, and your initial, and it will tell you when is the next time you need to change it depending on the policy. Okay. So I'm gonna pull the cap off, and then I would pull this cap off, but I already had it off, so I would try to not touch anything so that it won't get contaminated, and then spike it and twist to ensure that it has a good grip, and then squeeze the chamber. Okay, just halfway so that you know it's dripping. You can see the drip. You don't want it all the way. You want to be able to see the drip. And then I'm gonna hang up the solution bag. And this is my little IV bag. Or I meant my IV pole. Then I'm gonna unclamp it so that I can get the fluid to flow down, so that I can get rid of the air bubble, because I don't want any air bubble in the line that's going to cause a major complication like a pulmonary embolism. I'm gonna get a little bag to put my water in. Usually you can do it in the sink. is slowly moving down the bubbles. Trying to get all the bubbles out. Okay, so I was able to get all the air bubbles out. If you see there's any little bubbles here, you can flick it, just to ensure that you can get all the air bubbles out. And then this part would go into the patient's IV. You would have to scrub. You would have to scrub the hub on the patient's IV line for 15 seconds so that you won't contaminate and give the patient an infection. So that's for the primary line. Now I'm gonna add the secondary line, which is a lot shorter. I'm gonna do the exact same thing, which I'm gonna clamp it so that it won't flow, because this is usually medication and I don't want any waste any medication. So pull the tip off and then the cap off and then spike it, and then I would squeeze the chamber, and then I would slowly release the clamp because I don't want to lose any medication. Okay, so let's just say I have all the air bubbles out, just a little, one drop of medication drop. Now I'm ready to hook it up to the main primary line. I'm gonna find one on the connector here, and then what I'm gonna do is I have to scrub the hub for 15 seconds. And then twist it. Okay. And then since most of the time the doctor want the medication to go first, so if I want the medication to go first, I would have to put the IV bag higher than the fluid solution, because by gravity it will go down first. But before before I do that, I would have to do back priming, which I would have to lower the medication so that it can back prime. Okay, so I'm back priming it. The fluid's going up to medication, and then now I'm ready to put my medication above the fluid so that it will go down first. So this end I'm gonna take off, and then I'm going to screw up the hub and then attach it to the patient's IV line. And then I can open out the clamps. I can see that my chamber was dripping. That means that it's working, and that the medicine is going first, and then once the medicine is finished, then the IV fluid will start. Also, I forgot this part, but usually I will put the IV line in the IV pump, setting it to what the setting that the doctor order. It could be 100 milliliter per hour, 50 milliliter per hour, depending what the doctor order. Okay, I think that's the end of my IV priming. So, okay, thank you.